Hello and welcome to this recorded presentation for the employees of Carlton Oaks regarding your employee benefits program beginning June 1st, 2023, going all the way through May 31st, 2024. My name is Bill Hammond. I'm proud to be your insurance expert. My contact information is on the screen. Also available to you should you have questions is Rhiannon Gibbs-Lopez and Anna Narvaez. Anna is bilingual, so if you have questions in Spanish that you'd like to ask, feel free to reach out to her. Quick agenda, we'll talk about the timeline of open enrollment, the medical plans available, the dental and vision plans available, talk a little bit about the enrollment portal, and of course, where do we go with questions. So first, what is open enrollment? From May 1st till May 12th is our open enrollment period. This is where you can enroll in benefits, waive the benefits, add dependents, remove dependents, change from one plan to the next. Whatever you do will be in effect as of June 1st. So however you're currently enrolled, or if you're currently waived coverage, that will continue to be the case all the way until June 1st when the new plan year starts. Please complete your enrollment no later than Friday, May 12th, and we'll do all of our applications online at the EASE Benefit Enrollment Portal. So we're not really making any changes this year. We have 5 medical plans available. We have 3 HMO plans and 2 PPO plans. So we have the Bronze Aetna Value Network HMO plan. This is the base plan. This is the plan that your employer pays a large portion of for employee only. Then we have buy-up plans. There's a Silver HMO plan, a Gold HMO plan. Those are great for those of you that might have more claims or more health expenses that you want covered at a little better rate. And then for those of you that want a lot more freedom of choice, there's the Bronze PPO and the Silver PPO. So we'll get into some details of these 2 plans now. Here is our 3 HMO medical plans. Here's our Bronze plan. This is our employer-sponsored plan, or the base plan, if you will. There is a very large deductible, $7,900 deductible. That's a big deal because if you go to the hospital or if you need lots of care, you're going to be paying for most of the cost of these things up front. Once you hit your deductible, that's the same as your out-of-pocket maximum. So once you spend $7,900 on the year, you're covered at 100%. There is a lot of benefits where you see this term deductible waived, or DED waived. It means deductible is waived. So if I'm on this Bronze plan and I want to see a regular doctor, it's $75 for a primary care physician and $125 for a specialist. Deductible waived, so I do not need to spend the first $7,900 first. I get that $75 copay or the $125 copay day one, $1. If I need blood work, x-rays, labs, whatever it may be, it's $125 copay, deductible waived. If I need a CAT scan, a PET scan, an MRI, or complex imaging of some kind, deductible waived, it's a $400 copay. And if I need some rehabilitative therapy, so rehab, physical therapy, stuff like that, it's $125 per visit, deductible waived. When you start getting into some of the habilitative treatments, you have to pay your deductible first. Chiro is a $35 copay, deductible waived, 20 visits a year. So you might ask, well, when does this big deductible come into play if all these benefits I get before my deductible? Well, once you get into prescription drugs, hospital stay, emergency room, right down here, this bottom half. So you see it says combined with medical plan. So what this means is you are going to pay, now if you need a regular generic drug, you'll pay up to $35 for that drug. If it's a $4 drug, you're only going to pay $4. You're not going to pay all $35. For tier 2, 3, and 4, tier 4 is not on here, but it's kind of self-injectable drugs, these experimental drugs, some of the cancer treatments and stuff like that. You have to pay 100% of the deductible, $7,900, and then after that, you don't pay anything for brand name drugs. Same with the hospital stay, 0% after deductible. This means after you pay $7,900, you don't pay anything for a hospital stay or surgery or emergency room. This also means that if you go to the hospital, or if you need surgery, or if you're in the emergency room, you're going to pay 100% of the cost, up to $7,900. After you meet that, and which is your out-of-pocket maximum, you don't pay for anything. Here you see the Silver plan, lower deductible, $2,500. Okay, much more manageable. A little bit higher maximum out of pocket at $8,750, but doctor visits are cheaper at $55 for a regular doctor, $90 for a specialist. If I need blood work, it's $55. It's $90 for X-ray. Notice here now, my $300 copay for MRIs or CAT scans or PET scans is now after the deductible. All right. So after, if I need an MRI, I have to pay 100% of the cost for the first $2,500, and then I get a $300 copay. All right. Physical therapy, occupational therapy, speech therapy, $55 copay. Chiro is not covered on this silver plan, which is interesting. Prescription drug benefit is much better. Our generic drugs are $19. And if you need a brand name drug, you'll pay 100% of the cost for the first $300, and then you'll pay either $85 or $110 for brand name drugs. Here you see on hospital stays and surgeries as well as emergency rooms, there's a percentage. So what this means is this. If I end up in the hospital, let's say I have a $100,000 problem, I would pay 100% of the first $2,500, and then that means there's $97,500 left over. You would pay 40% of that $97,000 until your total out-of-pocket expense, including your $2,500 deductible, equals $8,750. So this 40% and the 35% for surgery and the 30% for emergency room, all of these numbers cap out at $8,750. Once an individual has spent $8,750, then you don't pay anything else for the rest of the calendar year for all of these covered services. So let's say you did have that $100,000 hospital problem, you'd pay $2,500, and then you'd pay the remaining $6,250, which is $2,500 plus $6,250 is $8,750. So once I spent $8,750, I don't pay for doctor visits, lab work, MRIs, prescription drugs, hospital stays, emergency room, urgent care, none of it. All right. So that's why this maximum out of pocket is such a big deal. Over here at the gold plan, this is going to be the best plan. These will be the best benefits that we have available to us for those of you that might be having a baby, might have a surgery coming up, might have a lot of medical needs or times that you need to get prescription drugs or have MRIs and stuff like that. I might encourage you to look at this gold plan. There is no deductible, so you're never out 100% of the cost of anything. The out-of-pocket maximum is lower at $7,000. Doctor visits are much cheaper. Diagnostic lab and x-ray is cheaper. MRIs are cheaper. Everything's cheaper. There's no brand name drug deductible. The copays are lower. But most importantly, if you look at the hospital inpatient services, you don't see a percentage like we did here. What you see is a flat dollar copay, 4 days maximum. So this means if I'm in the hospital for 2 days, I'm going to pay $1,000. If I'm in there for 10 days, I'm going to pay $500 day 1, 2, 3, 4. And then on day 5 and beyond of the same hospital stay, I'm no longer paying that $500 copay. All right, so that most you'll pay in a hospital stay for room and board is $2,000. Outpatient surgery, so if I needed a surgery, I'd pay a flat dollar copay of $300. And if I went to the emergency room, it'd be a flat dollar copay of $250. Urgent care is $60. And again, all of these numbers are accumulating towards this maximum out of pocket. And once you hit this, you don't pay for anything any longer. Also notice the family numbers are double for all of these things. And it says the word embedded. Embedded means that there's really 2 of these deductibles and 2 of these out-of-pocket maximums, where no one person in the family unit would be asked to pay any more than their individual deductible or individual maximum. So I'll give you an example. Let's say it's me, my wife, and our 3 children on this silver HMO plan right here. Once I have spent $2,500, I have met my deductible in full, and now the rest of my family has the other $2,500. And then if I had that $100,000 hospital stay and I paid $8,750, once I've spent $8,750 as an individual, I am covered at 100% for the rest of the calendar year, and my family would have the other $8,750. Okay, so no one person in the family unit pays any more than their individual deductible or maximum out of pocket, and no family pays any more than the family number. All right. Let's look at our PPO plans. So we have a bronze PPO plan, again, high deductible. There's some things waived. So we have doctor visit copays waived. If we need blood work, there's a copay for that waived. If you need chiro, the deductible is waived there. And then all the way down to urgent care, there's a deductible waived there. However, everything else, wherever you see after DED, combined with medical and prescription drugs, after DED on the hospital services, this means that on this plan, for most all expenses, you got to pay 100% of the cost up to $7,350. And then our silver plan, this is our best PPO plan we have available. Lower deductible at $2,500, still has a pretty high out-of-pocket maximum, but then we see our copays are much more reasonable. The prescription drug benefit is much more reasonable. So those are our 5 different plans. We have our 3 HMO plans, and we have our 2 PPO plans. So a couple of extra value-added benefits with Aetna. This is a kind of a little plug for the smartphone app and registering with Aetna online. If you want one thing you can do to improve your benefit experience, it's going to be to register online, to download the smartphone app. And with the smartphone app, you can find doctors. You can have your ID card on your phone at all times. You can find the nearest urgent care center, all kinds of stuff. So please make sure you do that. Also with Aetna, we have a teledoc program. This is also good through your smartphone app. You can download the teledoc app, register for it, and you can talk to a licensed doctor for non-emergency conditions 24 hours a day, 7 days a week. So lots of different things that can be done through this app, even mental health or dermatology visits. So really, really convenient app, especially for all of us with so many things to do, especially if you have a family. This is a really great benefit to look into. So talking about our dental plans, no changes here at all. We have our dental HMO plans, silver and gold. HMO dental plans are really great because they are low cost. They don't charge you very much on a per paycheck basis, and everything has a copay. All right, so every single different procedure, every different tooth has a different code and a copay. HMO dental plans are really great because they don't cost you very much, but the drawback is you don't have a lot of choice on who you get to see. HMO dental plans are great for those of you that don't have a very specific dentist that you want to see and are happy with choosing from a network of dentists provided for you. So that's the HMO dental plan. The PPO dental plan is really great because there's a lot more choice of providers. So you can go to lots of different dentists, lots of options for you. Here we have 3 different PPO dental plans. Dental PPO plans are more expensive. They give you a lot more choice. The other drawback could be there is a calendar year maximum. So this means that if you're on the silver plan, once MetLife has paid $1,250 total in benefits for you in the calendar year, they do not pay anything else, and you pay 100%. The platinum plan is $2,250. The platinum plus is $2,500. And again, once you reach this number, then MetLife is all done paying and you pay everything else. Just the opposite of what we talked about with medical, where with medical we said once you hit that maximum number, you pay nothing, they pay everything. PPO dental plans are just the opposite. HMO dental plans do not have any maximum annual benefits. That's another plus for them. So remember, HMO dental plans cost you less, but you can see less people. PPO dental plans cost you more, but you can see more people. Let's talk about vision real quick. We've got our 2 vision plans, the gold and the platinum plan. Both of these plans really are truly identical in every way except for one very important one. Both of these plans have a $10 copay for an annual eye exam. You get that benefit once every 12 months. That's what this first 12 is for. The second 12 is the frequency in which you get your lenses benefit. You have a $25 copay on the gold and a $25 copay on the platinum. You get new lenses for $25 every single year with this plan. The last benefit is your frames allowance. I've got it circled here as a $180 frames allowance between these 2 plans, same with both. The difference is with the gold plan, you get that benefit once every 24 months, and with the platinum plan, you get it once every 12 months. With the platinum plan, It costs you about $23 more per year for an individual, and you get $180 of benefits. So I think that the smart buy here is this platinum level plan. There's nothing wrong with the gold plan. I just find that the platinum plan is a much better value. If it costs me $24 of pre-tax premium in order to get $180 of tax-free benefits, I like that. I like the platinum plan because of that. So for those of you that are looking into a vision plan and need a vision plan, I strongly recommend the platinum plan. Both of these plans have exactly the same network of providers you can see. So let's talk about our enrollment process. All of you will be getting an email asking you to log in to the enrollment portal. Most of you have done this last year. You'll log in with your username, which is your email address, and the password. If you've forgotten that password, you can click right here. For those of you that are having trouble with this system, you're welcome to reach out to me, reach out to my team, and we're happy to help you with anything that you might need. But that is the way we are logging in and working on all of our benefit details. For some of you without email addresses or access to a computer, Andy Chin and your HR department has paper packets for you to complete if you'd like to enroll. So that's how you would do that. So what's the next step? Look for that ease email. It's going to be in your inbox here very shortly. You will log in, you will make your elections. Even if you are declining coverage, we still need you to log in and say no thank you. It's very important that we have everybody log in and do this. Your deadline to do so is Friday, May 12th. If you have any questions, if you need any answers, I'm here to help. My team is here to help. Again, Anna here at the bottom, she speaks Spanish. So if you want to have some of these questions in Spanish, feel free to email her and she will set up a time for the two of you to talk. Thank you so much for paying attention. It's an honor to be your broker, and have a great day.